We're learning a lot more about the genetics of cancer. We know that there are risk factors that can run in families that increase that risk for cancer. And by knowing these risks ahead of time, there's things that we can offer patients as far as screening and risk reduction. If there's a family history of early onset cancer, so anything diagnosed before age 50, especially for things like breast cancer, colon cancer, those are things that we do pay attention to in the family history, and we look for those types of things because those could be suspicious of some hereditary predisposition. We also want to know if multiple people have had cancer in the family. They should make sure that their doctors or their providers know about the family history of cancer, just like they would for any other health condition. That's important information for their providers to have. And from there, their doctors can decide if genetic testing or genetic counseling is something that would be appropriate for them, and if it's something that they could benefit from. In the genetic counseling session, we spent a lot of time gathering information about the family history, reviewing that together, talking about the genetics of cancer, discussing why or why not their family history might be suspicious for a certain condition. We would talk about genetic testing options and what this information could provide for a patient and how they could use this information to benefit themselves or their family too. We want to make sure that they know what they're getting into with testing and that this is something they feel comfortable with and that all of their questions are getting answered. If we know that they have a risk for certain types of cancers, then there are actions that we can take. So for example, if we know that a person's risk for colon cancer is increased, then we can offer colonoscopy screenings or colon cancer screenings starting at a younger age, and we would do those more often. It's the same with things like breast cancer. Then we can start screening them at younger ages and screening them more often. And we can also, in some cases, discuss risk reduction strategies as well.